I wanted to do a video about a disease that is becoming a little bit more well known because people like me have been talking about it for a long time. I'm not making any claims that it's because of me. I'm just saying because of people like me talking about it, we are bringing a little bit more awareness. Because of an actual situation that occurred with a client of mine, I thought it would be pretty helpful for maybe somebody out there watching who might be having the same issues or asking the same questions. Back in 2001, I was diagnosed with what at the time was considered a rare adipose disease called lipedema. This was a solid 12 years before I even started on my weight loss journey, so how I could possibly have been diagnosed with this while I was close to 400 pounds is amazing to me, especially since even today it's still very, very hard to diagnose. When I lost over 200 pounds, I actually did reverse my lipedema by one stage and one letter. However, after a major surgery that I had in 2016, I had a flare-up so bad that it spread to my arms and I was losing my mobility. I required liposuction to remove some of the diseased fat from my legs to restore what I had lost. And it worked and everything's fine and dandy now, but I do still have trouble on occasion. I do have to be very careful with the things that I put into my body and the types of activities that I do. And I need to make sure that I am constantly taking care of myself and well rested. So easy. Lipedema is a relatively common but often misunderstood and underdiagnosed condition that primarily affects women. It's characterized by an abnormal accumulation of fat, usually in the lower extremities, such as the hips, the thighs, the butt, and sometimes the lower legs towards the ankles. Lipedema can lead to a disproportionate pear-shaped appearance with relatively normal fat distribution in the upper body, but excessive fat in the lower limbs. This condition is different from obesity or lymphedema, but it is frequently misdiagnosed as one of these two conditions, which can lead to delayed or inadequate treatment. So how is it commonly misdiagnosed? Lipedema typically results in a symmetrical, disproportionate accumulation of fat in the lower body, while obesity can lead to a more generalized increase in body fat. Individuals with lipedema often find that traditional weight loss methods, such as diet and exercise, have limited effectiveness in reducing fat in the affected areas, and in contrast, obesity is primarily managed through lifestyle modifications. Lipedema is a disorder of fat accumulation and can coexist with lymphedema. However, it is important to distinguish between the two conditions. Lipedema causes discomfort, pain, and bruising, but it does not typically lead to swelling or pitting edema, where pressing on the skin leaves a dent. And lipedema may also present with easy bruising and tenderness. Lymphedema is caused by a blockage or a dysfunction in the lymphatic system, leading to the accumulation of lymphatic fluid in the affected area. This condition results in persistent swelling and a high risk of infection. Lipedema is often misdiagnosed as obesity due to its superficial similarity in terms of fat accumulation. Some healthcare providers may dismiss a patient's concerns about their appearance or discomfort, attributing it solely to excess weight. Not fair. Lipedema may also be confused with lymphedema when both conditions coexist, which can further complicate the diagnosis. However, proper evaluation by a skilled healthcare professional can differentiate between the two conditions. While lipedema is not curable, there are various treatments available to manage the condition, including manual lymphatic drainage, compression therapy, and specialized liposuction procedures designed for lipedema patients. Early diagnosis is critical to ensuring the most effective management and reducing the progression of the symptoms. It is a progressive disease. So the client I was referring to earlier came to me stating that she needed help with losing weight because her doctor had classified her as obese. I met her through a Zoom call, so I only saw her from the chest up, and she didn't appear to be obese to me at all. And I know that everybody's kind of different with their body shape and size, and that's not the whole picture. But as we went through the intake process with her during her free consultation, I started to ask her questions about her body shape. And she stood up and showed me her whole body. And I knew immediately this was not an obesity issue. This was definitely a lipedema issue. I was able to educate her a little bit about it and tell her that she needed to go back to her doctor and get a referral to a specialized doctor. General practitioners can't diagnose this, and you typically need like a vascular surgeon, which is what I had. I gave her a slew of resources and information to take to her family doctor to start this process, and it changed everything for her. Obviously, she didn't come on as a paying client because during this free consultation, we realized that she didn't really need my services for what she had originally come for. But she sent me a message to thank me for helping her help her doctor to realize that she wasn't having issues with obesity. Lipedema is a condition often mistaken for obesity or lymphedema due to its unique characteristics and the lack of awareness among healthcare professionals. Timely and accurate diagnosis is essential to provide appropriate care and support for people who have lipedema. So if you suspect you may have it, it is crucial to seek out a healthcare provider who is knowledgeable about this condition to get the proper evaluation and testing and treatment. If you would like any help regarding questions about that and the types of things that you can take to your doctor, you can message me and I will see what I can do for you. If you would like any more information about any of our health and lifestyle coaching packages, please feel free to message us here on the page or email us at info@bemehealth.ca. Have a great day.